Hi, my name is Michael Lopez, and this is a public service announcement for the Rocky Mountain Spotted Fever.
The Rocky Mountain Spotted Fever is a tick-borne disease first recognized in 1896 in the Snake Valley River of Idaho. It was originally called the black measles because of the way the rash looked in the late stages of the illness. It was often known as a fatal disease affecting hundreds of people living in areas of Idaho. By the early 1900s, the disease could be found in Washington, Montana, California, Arizona, and New Mexico. It is a bacterial disease spread through the bite of an infected tick. Most people who get sick with Rocky Mountain Spotted Fever often show symptoms of fever, headache, and rash, and it could be deadly if not treated with the right antibiotic. It is often transmitted by American dog tick in eastern, central, and western United States by the Rocky Mountain wood tick in Rocky Mountain states. It also been shown along the US/Mexico border.
So the transmission of the Rocky Mountain Spotted Fever, its tick vector primary host is through dogs. They thrive in areas that are protected and retain moisture, woods, grassy fields. They like to live in old furniture outside, mattresses, textiles, wood piles, and other types of solid waste. Tick seasons through March through October. And here we have a diagram of its life cycle from adult to larvae to nymph to adult, and they all can infect a human in either stages, and their carriers are these dogs, so it's easy access to humans, but also humans can get infected by being outside, outdoors, in the woods, in grassy fields, or doing some type of outdoor activity. Here we have the symptoms of the Rocky Mountain Spotted Fever. You have a fever, headache, rash, nausea, vomiting, stomach pain, muscle pain, lack of appetite. Here we have a map of the United States where the tick is prevalent, and the high reds we have high contact, and pink to light pink. Here you have a diagram of a person and its infected areas. Clinical presentation, you have a tick bite, abrupt onset of symptoms, fever, headache, myalgias, rashes, and antibiotics is known for its treatment. Here we have the prevention. Treat clothes with insect repellent when outside or outdoors. Check clothes when coming in from outside. Medical treatment, early detection, and report cases as soon as possible, so there's a tracking. Environmental actions, you have vector control, tick collars and dogs, clearing of house, the yard, of debris where vectors might tend to live or migrate. Public education, of course. And here to the right, I have a little picture of the vector host cycle. The R. sanguineus is a brown dog tick vector. Be familiar with that. Case detection, you treat with doxycycline, environmental control, home assessment, your pesticide spraying, tick collars for dogs, and of course your education, community outreach, your healthcare professionals. Here we have this treatment of the Rocky Mountain Spotted Fever. The symptoms occur 2 to 14 days after initial bite of infected tick. You have fever, headache, malaise, muscle pain, nausea, vomiting, or neurological signs. Diagnosis is through blood work or biopsy of the infected rash. Doxycycline is the first line of treatment, which is an antibiotic. And here we have a little flow chart of initial symptoms. And here you have a patient with a fever. And it goes if it's more than 2 days, and it's yes, you can treat it with doxycycline. Or if no, and if all these other symptoms come up, then you treat it with doxycycline. So the main treatment for the Rocky Mountain Spotted Fever is the antibiotic of doxycycline. And of course, you educate the patient and educate the public on the importance of getting medical treatment when infected with this Rocky Mountain Spotted Fever. Here we have is the One Health analysis. And what's causing the increase of this emerging pathogen? Climate change, the increase of vector population, giving it optimal conditions for reproduction. Human encroachment, giving it ideal opportunities for the emerging pathogen to keep its life cycle strong and keep it going. And how do we combat that? Through surveillance and tracking the vector activity, educating the public of the effects of the Rocky Mountain spotted fever. We can help curb the spread of the Rocky Mountain spotted fever by being vigilant and knowing your surroundings and staying safe.